Now, Ugandan authorities are heightening efforts to minimize HIV and AIDS infections by providing modern testing kits for the people. Now, this new form of testing will allow individuals to know their HIV status in less than 20 minutes, which is expected to encourage more people to do the test, especially those who were reluctant to do it in public. Now, the self-testing initiative has been welcomed in the East African nation. Details of that in this report.
This is the Check Now HIV self-testing kit, a new technology to quickly detect HIV infections. Ugandans can now know their status in a private and convenient setting.
This kit will be an additional tool in our arsenal for HIV testing, which is the key entry point for HIV prevention and control interventions.
The self-testing campaign is targeting most at-risk populations, such as young people and men who fear testing in public. In less than 20 minutes, one can tell his HIV status after testing with this self-testing kit. Health authorities are now promoting self-testing kits as one of the ways to reduce HIV/AIDS infections in the country. The new testing kit alerts those who are found not to be sick to protect themselves, but also helps to link patients to care. Users are given a specific code to transmit results to health workers. The goal is to hit the UN 95-95-95 target by 2030.
For all people who could be having HIV, 95% of them, we have not achieved the percentage of 95% of them knowing that they have HIV. So we must therefore scale up testing programs to bridge that gap of making sure everybody knows his HIV status.
And many Ugandans have now welcomed the self-test kits.
Many people at the universities do not want to know their status because of many factors around them. So with this kit, it just makes everything simple.
Men didn't want to go. They don't want to involve going to the hospitals. They always think that maybe they don't have that time. But if you have it at home, yes, you just test yourself.
However, there is a fear that the test kits are still unaffordable to the targeted population. The government is now pushing for donor funds to make the HIV test kits available at a subsidized cost. Uganda's HIV prevalence rate stands at 5.8% among adults, but health authorities are pushing to bring the figure down to 0 new infections, hopefully by 2030.